We have made significant progress without a statewide mask mandate. The people of Georgia did this without shutting down restaurants or bars or closing churches or houses of worship. Georgians stepped up and did the right thing. The people of our state are resilient, and they have proven that over the last year. And as we've said many times before, people, not the government, would stop this virus. Georgia has been open, and Georgia will continue to be open because we are a state that values both the lives and livelihoods of all our citizens. When it comes to vaccine distribution and administration, we continue to make significant progress in vaccinating our most vulnerable Georgians. With 77% of our COVID deaths occurring in those over the age of 65, we focused on providing access to the limited supply of the vaccine to these high-risk Georgians. That approach has led Georgia to beat the national average in vaccinating seniors, with nearly 2/3 of our total senior population receiving at least one dose. With increased supply on the horizon, we worked quickly with Georgia Emergency Management and Homeland Security Agency to stand up 4 initial mass vaccination sites and announced last week that an additional 5 sites would go live a week from today. We also expanded vaccine criteria beginning this week in order to protect more high-risk Georgians and get our citizens back to normal. To ensure that we stay ahead of the increasing vaccine supply and any lagging demand among currently eligible Georgians, on March 15th, we will be expanding vaccination criteria further to include all Georgians over the age of 55 and those with high-risk conditions defined by the CDC. Dr. Toomey will cover these conditions during her update here in just a few minutes. But again, the criteria will open up on March 15th to Georgians over the age of 55 and those with high-risk conditions as defined by the CDC. Adding these additional high-risk Georgians will mean that vaccination will be available to categories that have accounted for 92% of our deaths due to COVID-19 in Georgia. As we have from the beginning, we will protect the most vulnerable to severe illness, hospitalization, or death, and enable Georgians to get back to normal. Provided we continue to see increasing vaccine supply, it is our intent to open up vaccination to all adults the first part of next month. For everyone currently eligible, I want to urge you to please make your appointment as soon as possible. The Department of Public Health's website has a vaccine provider locator tool, as well as a scheduling website for public health districts at dph.georgia.gov. You can also register for the soon-to-be 9 state-operated mass vaccination sites at myvaccinegeorgia.com. And with well over 2,000 private providers, including Kroger, Publix, Walmart, Ingles, Walgreens, CVS, and others, we will continue to encourage all eligible Georgians not to wait to get their dose. This vaccine, as we've said many times, it is safe, it's effective, and is our ticket back to normal. The more Georgians who choose to roll up their sleeve, the quicker we will get to that point. Over the weekend, following her second vaccine dose, I was able to give my mom a long-deserved, long overdue hug for the first time in over a year. It was a reminder of what we all have ahead of us as we continue to move through this process and get us back to a normal way of life. I am convinced that we will get there. I'm convinced that we're going to get there sooner rather than later if we continue to get shots in arms and if we continue to do all the things that have gotten us here over this past year. Thank you very much, and with that, I'll turn it over to Dr. Toomey for her update.